What exactly is MD Pharmacology all about?
So, choosing a department is paramount here. Please choose it wisely.
You are someone from hating pharmacology to getting into MD Pharmacology, right? So we'll be diving deep into each segment. What do you think, like what are the different colleges that offer the best MD Pharmacology, and why do you think they are best in? Hello, Medhustlers. Welcome back to another episode of Medhustlr, the channel where we decode healthcare for you. As a part of our Ruling In series, where we explore different medical specialties to help you make your informed decision and to rule the best specialty for you. If you are someone currently pursuing MBBS or in your NEET PG preparation, and you are wondering that whether MD pharmacology is for you or not, so this is the episode where we will be deep diving into MD pharmacology as a career. To start over, today we have joined with someone who perfectly embodies the journey from medical student to industry leader. He has done his MBBS from Shimoga Institute of Medical Science and went to pursue MD in pharmacology from JIPMER. He is currently working as a medical manager in cardiometabolics at Novo Nordisk. And over the past few years, he has been deeply involved in creating awareness and driving the field of rare disease across India. Through these experiences and insight, we will be decoding everything about MD pharmacology from academics, residency life, and top institute to the various opportunities this branch has to offer. So without a further delay, give me a moment to welcome our Medhustlr of the episode, Dr. Ranjan. So Dr. Ranjan, it's an absolute pleasure to have you on this channel, Medhustlr. So sir, welcome to the show.
Thanks a lot, Ame and Medhustlr team. So, it's my pleasure to be here, and I'll be really happy to share my experience as well as to interact much deeper so that I can guide some people who are wishing to take this path in their future.
Sir, before we dive into the discussion, so this was a Medhustlr style intro which I gave you about you, but I would also like you to introduce to our audience.
Definitely, why not? Hello everyone. So, this is Dr. Ranjan here. I'm basically based out of Bangalore. I'm native of Hassan in Karnataka. I did my elementary education as well as college in Karnataka itself in Hassan and Mangalore. Post that, I got MBBS in Shumaga Medical College, one of the government college inside Karnataka. And then after my MBBS, I briefly did a medical officer role under government of health Karnataka in a primary health center, which is in a remote place. I was enjoying it until some time, but afterwards I started feeling saturation with the practice. Probably there, I started taking a couple of decisions which kind of led me into this path. So then I was having a double thought: should I pursue clinical practice or should I try something else? And this is one path which I came across one of my senior who went to Jipmer long back, like he's almost 8 or 9 years senior. So he did MD pharmacology and he joined Novo Nordisk, and right now he is in Denmark. He's an international medical director. So that I kind of took him as an inspiration, I should say. And then I started exploring this option. I was giving NEET PG entrance. I was getting somewhere around 10,000 ranks. Probably with that rank, I would have got into any of the clinical branch in private medical colleges probably. And in central institute exams, in during that time, there used to be separate exam for JIPMER, AIMS New Delhi, and PGH Chandigarh. There was only one AIMS back then. Three central institutes were there, and NIMANS probably for psychiatry. And then I was cracking less than 1,000, but I was not getting around where I wanted. And pharmacology was my second option. I should honestly accept. I was probably thinking of doing orthopedics, but as I said, during my primary health center tenure, I slowly started losing interest on clinical practice. Then came Jipmer. I got somewhere around less than 500 rank. I had transfusion medicine and other options, but I wanted to explore pharmacology. As you know, like Mahatma Gandhi used to say, be a path bearer, be a change you want to see in a world. So then I thought, why not? Because I had other passions as well, like along with my medical journey. One is sports. I'm a volleyball player as well as badminton, so I play regularly. and I'm a huge fan of football. I can't miss a single football match, especially English Premier League. So and I go for biking, I do travel a lot, and painting as well in my free time. So all these hobbies, definitely I wouldn't have pursued if I had gone into clinical branch, maybe because I am someone who don't enjoy night duties. I am someone who can't work beyond 8 hours or 8.5 hours, because my attention span is very less. Maybe my quality will dip. So then I started deciding, okay, why not explore pharmacology, because that is the only subject which I used to hate during my undergraduation days, because I never really enjoyed reading pharmacology, which is very difficult and very volatile. But I slowly started loving it when I was preparing my PG entrance, because there was one professor in PG entrance exam in Trishur back in 2014 or 15. He was amazing. He was an excellent teacher, and the way he explained the critical areas, like areas of pharmacology, like autonomic nervous system and couple of autocoids, amazing. Then I started loving, yeah, pharmacology can be fun, if you properly teach. And then I started loving it. And then as soon as I got Jipmer decent rank, and one of my senior, as I said, he was Jipmer alumni. And then Jipmer is one of the best department, especially in national level for pharmacology, because they started pharmacogenomics and couple of very pioneer fields of pharmacology, special fields of pharmacology in India, way back in early 2000. So a lot of, probably KD Tripathi, have you must have heard it, right? One of the famous
Yes.
pharmacology textbook, most of the
Yes.
people in undergraduation reads. They're all Jipmer professors, you know,
Right.
um, Ghosh, KD Tripathi, and many people have come out of that department. I joined and then I never turned back. 3 years went very quickly, and then a lot of seniors were there, amazing alumni. Wherever, whichever pharma company you go, a lot of people will be there. Academics is amazing. I got amazing experience, and then everything led into this particular role. So 2019, I finished my MD, and then I joined Novo Nordisk, and I'm with Novo Nordisk for past 6 years, enjoying my life, traveling a lot, still watching football. I don't miss a single match, and I play badminton whenever I'm free and available, and I do paint sometimes when I wait for flights in airport, or whenever I'm free waiting for a doctors to meet. So this is my life and this is my story, and it's been lovely so far, and it's great. So this is how I landed in pharmacology, and I'm a pharmacologist and working as a pharmaceutical physician. No one Nordisk right now.
Perfect. So this is a true journey that scream made hustlers inside you. So sir, we will be diving from, you mentioned that you are someone from hating pharmacology to getting into MD pharmacology, right? So we'll be diving deep into each segment. So we have segregated for our viewers to segregate this podcast into various segments. So the first thing first, we will be understanding what is MD pharmacology. So to begin with, sir, I want to ask you to explain our listeners what exactly is MD pharmacology all about.
Sure. So probably people, have kind of stigma, or different opinion towards pre and para. So I don't, I don't encourage them. Probably I don't want to change their opinion. But basically, to discuss about MD pharmacology, it's a postgraduate medical degree which focuses on the study of drugs, which we all know, and their effects on human body, and the principles of pharmacotherapies. And here we learn about all the scientific principles underlying the drug, starting from its mechanism of action to pharmacokinetics, pharmacodynamics, all their safety, effective usage in clinical practice. So basically, it's a course typically talks about toxicology, clinical pharmacology, pharmacokinetics, and ethics in drug research. It's a fantastic subject, very interesting, with the proper disclaimers, like you should do it under very good guidance in a very good department, where the department should have some good research facilities and faculties which support and motivate you in doing research. So that's about MD pharmacology in a nutshell.
Perfect, sir. So, sir, next thing I want to we want to address here is how is MD pharmacology different from other branches of MBBS?
Yes. So here it is a bit different. It is same like other subject in terms of tenure. It is 3 years across India, whether it is a state government college or in a central institute. So here it combines the aspects of medicine as well as science. So it is not only a pre or paraclinical subject where you will be discussing, it's only, most of us have a, as I said, stigma thinking like pharmacology is just a teaching subject, right? But definitely not. It's a amalgamation of medicine science as well as clinical aspects to it. So here there'll be no surgical procedures. Basically it is concerned with all the biological system and the drug action, mechanism of action, everything we will study. More of a theoretical aspects, as well as we do some experimental pharmacology as well, where we do experiment on animals. You learn how exactly drugs acts on animals as well as humans, and there is a clinical touch as well. So we have clinical pharmacology in very few colleges where the faculties have expertise to train the people. So post your MD you can still do clinical DM, clinical pharmacology, where you will get a lot of experience to understand the clinical aspects to it. So for example, they will be doing a lot of pharmacovigilance studies, and they'll be supporting clinical trials of any clinical departments, and they will be doing safety analysis, and along with microbiology department they'll be running antibiotic stewardship programs. And it's a very interesting subject which has research, clinical application, as well as your knowledge to it. So basically it's a subject which is, very different from clinical, as well as very different from pre and para. It is evolving a lot in last 10 years, and it's a very fantastic subject to study as well as to apply in your clinical practice.
Perfect, sir. So that was a very nice insights about MD pharmacology and how it is different from other branches of medicine. So, sir, now I think you have just addressed about whether MD pharmacology is clinical or non-clinical. But if you want to explain more to our audience, like what is your take about MD pharmacology considering as a clinical or a non-clinical branch?
Yeah. So this is a very fantastic question, because very, very, I have come across this question a lot, especially in last 3 to 4 years, as soon as I started working. So there was a perception, it is still a non-clinical as per, uh, you know, uh, NMC regulations, as well as the subject that we consider in our undergraduation. But lot of clinical element to it right now, especially in last 10 to 15 years. Lot of clinical elements like patient care and patient safety and effective use of medications. So as with the inception of microbial resistance, now there is a huge role of pharmacologist, especially in clinical side. So we should not always say it's a non-clinical subject. We should never push it into a non-clinical aura. It's a subject which has a foundation of non-clinical, but now it is evolving into a clinical branches as well. So it has got clinical touch, and when it comes to non-clinical, we have regulatory affairs, pharmacovigilance, drug discovery, safety monitoring, policy making. A lot of different venues are there here. So I should say, in a single line, it is both clinical as well as non-clinical in the same go.
Perfect, sir. Just to summarize, it's about your take, how you want to evolve your career in the field. So it is
Yes.
both mixture of clinical and non-clinical. Okay, sir, perfectly addressed. Now we'll be moving to the next. That is, how has pharmacology evolved in modern medicine, especially with the advancement that we see nowadays, like in AI or data-driven drug design, and in the translational research.
Yes, so it's really good. So as I said, it is evolving really fast, and especially with the invent of AI and data-driven, applications, which is helping us a lot in terms of taking pharmacology to the next level. So here, the modern pharmacology is it's a very dynamic field and lot of applications are coming into force. I just give you one simple example. So there is something called as high throughput screening in clinical pharmacology. So there was a time, once upon a time, so there used to be a lot of targets to produce a drug. When it comes to clinical drug discovery, we find a lot of targets, and we, for example, in terms of lakhs, there will be lakhs of targets, and they'll take a simple receptors and they'll try to match it. Out of the lakh, you need to get a single molecule which is very perfect to this receptor, so that you can develop a drug. And just imagine amount of work which goes behind screening 1 lakh potential molecules to bring one important molecule into the medical science, right? It used to be a humongous task back then. Now with the help of AI, as well as couple of modern data driven or machine learning tools, now it has become very simple. You will do it in 5 minutes. It used to be 4 to 5 years of fights back then, but now it is just a matter of 5 to 10 minutes. You just load all the data into it, and in a single snap of finger, within 3 to 4 minutes, you will get 4 to 5 leads which will be evaluated by experts in some time. So this is the pace of pharmacology which is going really well, especially with the invent of AI. It is going really really fast, and it is really getting exciting. And especially now a lot of funding and a lot of interest is going towards clinical research. You know, all the governments are putting money into this. You just imagine India. It is becoming a pharmacology or maybe pharmaceutical hub in the world. And most of the Indian pharma companies are putting or investing money into the research. Earlier there used to be generic companies, lot of, they just used to bring copycats from the foreign market. Now it is getting really serious, and lot of job opportunities are going to come. And we should always thank this modern medicine which is kind of pushing pharmacology into the next sphere, where it is going to be really wonderful and interesting.
Perfect, sir. Thank you so much for this insight. As we have seen that AI is supporting each and every career, so it is very good to know that it is also enhancing the pharmacology as a career. So, sir, moving to the next, what do you think are the skills and mindset of a student who needs to success in this field of pharmacology?
Yeah. So again, this is a very important question. Pharmacology is really not. I'll just tell you this answer very honestly from my bottom of my heart. When you compare, orthopedics, or maybe like subjects like ophthalmology, or maybe any subjects like community medicine, you will easily love those subject as soon as you start reading, or as soon as you start exploring that subject. But when it comes to pharmacology, it is purely about your analytical skills and your memory, right? Starting from all the mechanism of action, class of drugs. You just, if you take anti-diabetics, there is some 8 or 9 different classes. Each class has some 15 to 20 molecules. Some molecules will get outdated, some new molecules will get added to it very rampantly. A lot of monoclonal antibodies are coming into this space, which requires a lot of critical thinking and lot of cognition. You need to read a lot, you need a lot of effort, you need to put a lot of energy into it, remember a lot of things, revise it. For that you need to have peace of mind, a lot of determination. And if you have all these skills, then pharmacology is going to be really easy, and you will start enjoying this subject. And now a lot of important areas are coming, like personalized medicine and precision therapies, which requires a lot of critical thinking and problem solving abilities as well. So if you have this skills, it's an added benefit. If not, all the basic things which I said, piece of sorry patience, determination, hardworking, these important skills are very very important. And having that mindset where you will have to go through these phases, then you will start loving pharmacology, and then you will harness your skills better, and you will definitely do well post
Yes.
pharmacology.
Perfect, sir. So now the viewers are very clear about what is the skills and mindset they require to get into this branch. So want to address is like as you have mentioned that MD pharmacology, when we get into it, we should do some from some of the top institute where the department is good. So just to address this question for our viewers, what do you think, like what are the different colleges that offer the best MD pharmacology, and why do you think they are best in their best in that department?
So I did a basic research before I joined Jipmer. So I was not having much connections. I had few friends, and I had no immediate seniors or maybe like very close friends who had done or who were perceiving pharmacology back then. And through internet search, I came across couple of departments across India which were good. One is Jipmer. It was in my top three list. And we had aims I had aims New Delhi in my list. It is again very good, premier institute which is close to government of India, which is doing really wonderful works. And they have comprehensive training, and they have got very good research facilities as well. And we have PJ Chandigarh, where again research is really good, as well as academic culture is really good. A lot of experienced faculties are there. These three colleges are amazing. You can, if you get any of these colleges, if you have passion towards pharmacology, then it's really good. And these three colleges are INI, like you have to write INI CET, Institute of National Importance, CET, separate entrance level exams. Now I think they have combined all three colleges together, and as per your ranking, you can get into this. If you are someone who crack NEET PG, and if you are trying to join, probably I should say the best college through NEET PG is KM Mumbai, one of the best in India. I think it is easily competing with all these three colleges that I mentioned earlier. Their academics is really good. They have clinical pharmacology DM seats as well. Their research is really good. A lot of multinational companies are doing phase two, phase three studies in KEM Mumbai. Amazing college, King Edward Medical College, with Seth Medical College. There, it's a single campus. And after that, probably I should say, Nizams in Hyderabad. That is one name I commonly come across, and people who comes out of that college is they're also really good. And there will be premier institutes of all the states. For example, in Karnataka, I should say Bangalore Medical College or Mysore Medical College. They stand out among other state government colleges. Probably in Tamil Nadu, I should say Madras Medical College. It is one of the best. Madurai Medical College, again, it is next best or maybe equally best. Similarly, like each college in Delhi, if you go Safdarjung, they are also having good pharmacology department, and we have MAMC, Maulana Azad Medical College. And right now, a lot of aims have come up across India. Aims Bhopal, Aims Bhubaneswar. Aims Bhubaneswar is pretty good, and Aims BB Nagar. Two of my pharmacology seniors are faculties there, and it is also really good. Aims Madurai, it is coming up really good. And I think a lot of Aims, they're also having very good departments, and probably they are going to be really good centers to study pharmacology. But in state, as I said, KM Mumbai, premier institutes across India for each state. Probably you should be your choice. And my sincere request is, please avoid joining pharmacology for the sake of completing it. Please don't join some very rare, remote colleges where faculties are not there or research facility is not there. There is no support for research. Definitely will not enjoy it. And once you come out of that, you will be having degree with you, but very basic skills, right? So choosing a department is paramount here. Please choose it wisely.
So that was a very nice disclaimer for our audience. So if you opt for any colleges, try to get the best in those that field. Perfect, sir. So, sir, also there are some students like who looks for the opportunities beyond India. So, how is MD pharmacology different in India versus abroad?
So I don't know, maybe I'm not expert enough to answer this question, because pharmacology, outside, most of the pharmacologists are basically PhDs. They offer PhD courses in pharmacology outside. There is no MD in pharmacology in Western universities. But again, the funding in those institutions are really, really good, especially if you are someone who is passionate in the field of research. then definitely you should go and you should explore this option. But I don't have much expertise to guide you here. But what I have seen is the research funding is really good, and especially PhD courses and PDF post diploma fellowships will be there. So you can do those courses, and they are very much research focused, and with a very good clinical exposure as well. So again, it will definitely shape your career. If you have this from Western or abroad universities.
Yes, sir. So now we have almost discussed about MD pharmacology. So now we will be diving into the career prospects after MD pharmacology. So whenever someone thinks about a branch, it is very important for them to understand how the life will be in the long term. So the very first question we want to tackle under this segment is, what are the different career opportunities available after MD pharmacology?
Yeah. So, I should say three options. One is academics, that is teaching. A lot of institutions are there across India. I think now you must be knowing, like, each state governments are, trying to improve the healthcare or health quality indices. So, as a part of it, they are building government colleges in each districts of India. Probably in Karnataka, we have close to 20-25 medical colleges. So back then we had only six government colleges. Now I think number is touching 25. And across India, you just imagine a lot of private colleges are coming. Academic positions are vacant in most of the colleges. I get a lot of WhatsApp messages for faculty positions across India. So that is one important career opportunity. And other one is industry. Industry is booming, and a lot of opportunities are there across industry because they have integrated medical affairs nicely now, and they are demanding, especially MD pharmacology people. And there are, even with other MD degrees also, people are entering pharmacology, pharmaceutical industry. I have a couple of friends with MD in community medicine. Ophthalmologists are there, pediatricians are there working in Novo Nordisk with me here. So there are multiple people can also join, but MD pharmacology gives you more skill sets which is suitable to join pharmaceutical industry. And third option is clinical pharmacologist in corporate hospitals. There'll be pharmacologist role in most of the important corporate hospitals, like for example Apollo or Aster. There'll be one or two seats or maybe like positions. If you have done MD pharmacology, it is sufficient. But if you have DM degree from few of the colleges, wherever DM is offered, they will easily choose you, and you will be working with clinicians in decision making and helping them with their decisions or diagnosing or drug safety. So these three options are there. And if you are passionate about research, if you are really keen about research, then you can go to Western universities. You can join some universities, do some PhD courses or PDF courses. Then you can get into hardcore research in multinational companies as well. So these are the four opportunities I would say. But in India, first three are available. The fourth option, you need to go to some biotech companies in US or Scandinavian countries where biotech hub is there. So there are multiple opportunities after MD.
Right, sir. So, sir, now we have a brief idea about the different careers. Now we'll be deep diving into each career to understand the dynamics related to each side of the career. So, sir, for someone who wants to build their career in corporate world after MD pharmacology, so how would someone begin his career, and what are the different roles that this field has to offer?